I'm trying to basically address the question a lot of people ask me, what social business and health are two different things. And I'm going to say that they have a lot of commonalities, and in fact, this integration is the main objective of my talk now. So if you look at from Professor Yunus's perspective, the business or service must come to people's homes. And that's how Grameen Bank operates. They reach the customer's homes. And same thing should happen, according to him, for healthcare as well. And if we have to reach healthcare to homes of such a large number of population worldwide, you have to make use of the technology that is most appropriately suited. And that's why the mobile phones come into picture here. And mobile mHealth basically involves healthcare delivery using mobile phones. And today, mobile phones are not just phones. All of them are computers. And therefore, if you can compare with a computer with a mobile phone, in terms of reach, in terms of access, mobile phones get you much wider access at much less cost. And that's why the use of mobile phones have become so important worldwide, and the World Health Organization has accorded so much importance to e-health or healthcare using ICT for the access and reach of healthcare. We have been working on this for the last 10 years at the Asia Pacific Ubiquitous Healthcare Research Center in UNSW. That was set up in 2006-07, almost 10 years ago. And this is, as you can see, to solve real-life problems, we have to go across disciplines. For example, if you go to a businessman, well, I want to make this business work. I'm an economics person, I'm a public health person, I'm an engineering person, computer science person. The businessman does not care. In the end of the day, the problem needs to be solved, right? And that's why we have brought together at least three disciplines or three faculties of UNSW, medicine, engineering, and business, to start this activity. And it's interesting, a lot of people talk about multidisciplinary research, but in the end of the day, very few succeed. And we have, I would say we have been successful in the sense that we have got so much of participation from not only within UNSW, but outside UNSW and many countries as well. Shall we go to the next slide, please? Oh, okay. So if we look at the Yunus social business objectives, I've just listed down the main objectives to help the weaker sections of the society, poor, elderly, disabled, just to broaden the scope a little bit. Leverage technology for social business benefit, and in this case, mobile phones for healthcare, an example. Leverage social business principles of Professor Yunus to make ventures for weaker sections sustainable. Sustainability is a big problem. If you look at the European Union's record of statistics, there are hundreds of projects that go on trial, but they never they never get converted into commercial successes. And therefore, it's very important for us to design businesses for health or social business that works and sustainable. And that's where we would like to use social business principles. And next aspect is the focus on deployment of innovation collaboration with business and industry. So basically, we have to show that these things actually work, not just on academic papers. So why mHealth? I just mentioned earlier, the rapid proliferation of mobile phones that gives you access. If you look at the statistics, the metrics of Institute of Medicine, there are 4 ways of assessing technology. One is access, second is quality, third one is acceptance by concerned people, and fourth one is cost. And here you can see the familiarity of all sections of population with various mobile phone apps, and that makes technology acceptance much easier. A lot of very good technologies do not see the way, the end of the tunnel because of the lack of acceptance, either with the healthcare professionals or with people. Affordability of mobile applications in resource-poor settings. That's another major important thing. As you probably know, that a lot of developing countries now have mobile phones in far areas, but they don't have the normal optical fiber cable or infrastructure like that in many of those places. And therefore, that's how a mobile phone can be a vehicle for reaching social businesses to the target audience much faster and much more effectively. And here are some more examples. If you look at from the point of view of chronic diseases, they require behavior change, and we have been currently working on mobile phone-based persuasive systems. Just sending an SMS for a person to give up smoking will not work in many developing countries. And therefore, you need to have a number of interventions in terms of videos, games, chats, and other types of mechanisms to divert the attention of the smoker. And then, of course, the health communication to remote locations, such as countries with a number of islands, PNG, Philippines, Indonesia. I'm glad that Alex is here. He worked on using mobile phones for disease surveillance in Papua New Guinea. And similarly, developing countries also face acute shortage of health professionals, and therefore mobiles would help us with the utilization of scarce resources. For example, in a disaster situation, the people in the field can be provided context-sensitive help for any kind of expertise on the mobile phones. And whereas that in the past they used to have to carry big manuals to be able to know where to refer to the problem. The rural population of many poor economies rely on informal care providers. So that's we are running through a project in Bangladesh, as Teng mentioned, and that's another thing where we'd like to see how to reach the healthcare through mobile phones to remote communities in developing countries through their informal structures. You can't impose the formal medical systems on them because they have been using that system, the informal system, for many, many years now. So it's a complex problem. So when we talk about social business and mHealth, they are basically intertwined in terms of solving the real problems in healthcare. This is a quick overview of what we have been doing in developing countries. We started with the disaster management and then subsequently went on to pandemic management. One of our PhD students completed his work on comparing pandemic management preparedness across Australia and China. Mobile health kiosks for refugee camps we developed for Banda Aceh that went on trial in 2005. Unfortunately, the trial was not successful because the network would only be able to support any communication between 2 to 4 a.m. in Banda Aceh at that time. That was 2005. So, but this highlighted the fact and that there was a major network congestion, and subsequently Japanese government came and helped Indonesia to set up a WiMAX network in Banda Aceh, which I understand has taken care of that problem. But interestingly, from 2 to 4 a.m. we found the network, that system was heavily utilized. Why? Because the people in the field, nurses and doctors, they would use that to look at the journals in the international arena. So it got converted from a mHealth solution to mEducation or mLearning solution at that point of time. And then, of course, we were invited by WHO to participate, to lead this multi-country project. Pretty ambitious project on various types of e-health interventions and their effectiveness. And we found there's so much of diversity in technology and conditions that it was impossible to carry out that kind of a study in a small setting. And therefore, in the end, we came up with the multidimensional e-health readiness model, and that was submitted as the report to WHO to assess whether to spend money on the technology at all. And then, of course, finally, we came out with the Global mHealth Assessment Initiative that Teng mentioned earlier. And finally, in the APHC in Bangladesh, we have partners. Almost all of those from Bangladesh would recognize these names: ICDDRB, Yunus Center, Bangladesh University of Health Sciences, which is based on BARDEM's continuation. And then we have completed the project on quality assessment of mHealth. And there are the ongoing projects with these partners. Shahriar is going to talk about the completed project quality assessment, and that has been so successful, and Professor Yunus basically selected us for this YSBC based on the success. Thanks.